Have you ever wondered what the real difference is between a hospital and a community pharmacist? In this video, I'll walk you through the jobs, career progression and salaries for both a hospital and community pharmacist. And we'll think about which job might be right for you. So the first job we'll cover is a hospital pharmacist. As a hospital pharmacist, your main role will be to work on wards, making sure that patients receive the correct medication in a timely manner. How it works in a hospital is that every patient has a drug chart where their medication is prescribed. It's the pharmacist's job to look at that drug chart, make sure everything's appropriate on that drug chart, and make sure the medication that needs to be supplied is supplied. So when a hospital pharmacist looks at the drug chart, they're looking, does anything need to be stopped that the patient was taking before they came in and that was accidentally prescribed? Does anything need to be started given the patient's new presentation that hasn't been started yet? And for everything prescribed, has it been prescribed correctly? For example, is the dose correct? Are the timings correct? Has it been prescribed in the correct form? For example, oral, subcutaneous, IV, just to make sure that the patient gets the correct medication essentially. Following that, you need to make sure that the medication is then available for use for the nurses to give to the patient. So the pharmacist will order a medication to come up from the hospital pharmacy to the ward. This is where you might have to suggest an alternative, for example, if something isn't available to be ordered, or work out a way of getting it from maybe another hospital, or organise for some to be brought in if it's a specialist medication by the patient themselves. So a hospital pharmacist can work in many different areas around the hospital. Most of the time it's on wards, but you might find yourself working in specialist clinics in like an outpatient setting, doing things like specialising in anticoagulation, or in cancer services. Some pharmacists work solely in the hospital dispensary, making sure that all the medication that leaves the dispensary is issued to the right person with the right instructions on it and is issued to the right location of the hospital. So what does a community pharmacist tend to do? Community pharmacists tend to work in high street shops or chains where they receive prescriptions from healthcare professionals like doctors and dentists, then supply the medication to the customer, making sure that the medication is still appropriate for that person. If a prescription isn't legal or a safe dose has not been prescribed, it's that pharmacist's job to then get in contact with the person who's prescribed it and get the prescription changed essentially. Alongside this, a community pharmacist is also responsible for overseeing all of the over-the-counter sales of medications. When you go into the pharmacy, you'll see medication behind the counter or on the shop floor. When the pharmacy is open, the responsible pharmacist is essentially takes overall responsibility for the sale of medications. So they have to keep some oversight on everyone selling medication in the pharmacy, make sure it's appropriate for whoever comes in to buy it. Recently, there's been a big push for community pharmacists to take on extra services from GPs to reduce their workload. This means that alongside dispensing and checking prescriptions, a community pharmacist will have to carry out a number of services, such as administering vaccines, giving out medication under the Pharmacy First scheme for like UTIs, shingles, taking blood pressure readings and checking how patients are getting on with their new medications in the new medicine service. Community pharmacy is transitioning more towards a clinical role rather than just dispensing medications, and it'll be interesting to see where it goes over the coming years, especially with the new prescribers all coming through university. What's the career progression or salary like for a hospital or community pharmacist? A hospital pharmacy has a much clearer progression pathway than community pharmacy. Once you graduate university, you start as a Band 5 trainee pharmacist, whereas you can then progress all the way up to the chief pharmacist that sits at a Band 9. So these figures are all for 25, 26 year, and they're public knowledge because the NHS banding system is kind of set in stone. You can't negotiate your salary. So as a Band 5 trainee pharmacist, currently you'd start on £31,048. So while doing your training year, you can then start applying for qualified pharmacist roles. So as a qualified pharmacist, you'd work at a Band 6 level. So currently as a Band 6, you'd start on a salary of £38,682. So as a Band 6, you start working on wards a bit more independently and start completing like your clinical diploma. After a bit of experience, you can then apply to be a Band 7 pharmacist, which is like a senior pharmacist. The current starting salary for a Band 7 pharmacist would be £47,810. As a senior pharmacist, you start supporting the junior pharmacists in their work. You might become like a line manager. You may start to specialise at this stage. For example, you might specialise into cancer services, sexual health, critical care, or something like anticoagulation. Just to note, the mental health pathways tends to be like a separate kind of pathway to go down. People don't tend to jump across from physical to mental health. You kind of have to build up your experience on the physical health side or the mental health side. So with a bit more experience and having conducted some like audits and having some experience managing people and teams, you can start applying for Band 8A jobs. So as a Band 8A, you'll typically either be a highly specialised pharmacist in a specific area, like cardiovascular, surgical, critical care, or you might be like a lead for a certain area, for example, surgical lead pharmacists, anticoagulation lead pharmacists, a geriatric lead pharmacist. So as a Band 8A, currently your starting salary would be £55,690. Jobs above Band 8A doesn't come out as frequently as like Band 6, 7 and 8A jobs come out, but it's possible to work your way up until a chief pharmacist, which is a Band 9. When working as a community pharmacist, you're working for a private company which does NHS prescriptions essentially. So you're not officially employed by the NHS. So the salaries that people get aren't as clear, but there is room for negotiation of your salary when you're a community pharmacist. Community pharmacists tend to start with a higher salary than hospital pharmacists when they first qualify. And over time, working as a community pharmacist, you can develop skills which can bring more money and services to the pharmacy. For example, being able to issue contraception, being able to run a travel clinic, or being able to issue weight loss medications. So I still definitely think pharmacy is a great career to do, especially if they were set on doing a health related career. It gives you a solid earnings base, and even if you decide not to stay in the career, there's always that safety net that you can go back to working as a pharmacist as long as you keep your registration. It gives you the ability to take some risk while working, as you can always fall back to locuming as a pharmacist. However, locuming definitely isn't as lucrative as it used to be. If you're more interested in clinical practice, advising on management plans and reviewing medications, then hospital pharmacy may be for you. However, you might need to do on-call shifts when you first start working, and the frequency of these can vary depending on what hospital you work for. That's something you won't have to do in community pharmacy. But if you've got more of a business mind, a business acumen, and don't mind working directly with customers and patients, then community pharmacy may be for you. Which career path do you think suits you better, hospital or community? Let me know in the comments, and don't forget to like and subscribe for more pharmacy career videos.